Hello. Today is 1 week exactly, and as the incisional pain, so abdominal edema, swelling that is normal post-op, begins to subside, and the incisional pain begins to subside. Sorry, mixed up my words. Internal pelvic pain has increased, so it is 2 steps forward, only 1 step back, but probably to be expected for this progression. So as a pelvic PT recovering from endometrial excision and a hysterectomy and lysis of adhesions, I'm in a unique situation. Usually I would schedule my pelvic PT with someone as a patient, but now I'm doing both. I'm the pelvic PT, self-treating post-op. So far, the needs for therapy I can cover on my own. There will be a point where I can't, and I'll have to get some help with that. If I cut hair for a living, it would be like trying to cut my hair from the back, right? There's just some things you can't do by yourself in your own profession. So, so far to address the increasing internal pelvic pain, which I did a quick check on, and it's very kind of edematous and boggy, and lots of tender points, some pelvic floor tightness. Things are sitting a little lower than they should, but everything is swelling. So again, abnormal, but normal for what the situation is. So today I did see my yoga blankets? Legs up the wall pose. I also used my heart pillow, which you have seen lots, but it actually is going here to provide weight and some fancy compression, which is helping. So after legs up the wall pose, that was my test to see if maybe I was up too much too soon on day 7 yesterday. And I think that was the case. I was upright too long, too much gravity, too much sitting, and maybe a little bit too much walking. And gravity is not kind to the situation. I need what's left after the hysterectomy to stay where it should and not drop lower, because that would be indicative of a prolapse. So if you're wondering the symptoms I'm feeling, it is prolapse type symptoms. It's heaviness in the pelvic floor. It's kind of a dragging ache sensation, classic of prolapse, because I've had one. I know what it feels like. So that's what I'm feeling. There was actually some sharp internal, like shooting pelvic floor pain, and I recognize that also as pelvic floor tightness. It's going to do that. It's protective, mechanism of the pelvic floor to do that after all the surgery and everything that I've been through. But if you're experiencing it, I just want to say you don't have to be afraid, right? Like, oh my gosh, am I internally bleeding? Is what's happening? And should I go to the ER? That kind of thing. I know that I don't need to do that because I recognize it as simple pelvic floor dysfunction that is a part of recovery from the surgery. Certainly if you're having any bleeding that's outside the norm of what you were told was normal, that is, an ED visit for you. But I know that everything that I'm experiencing currently is to be part of that recovery. The other thing that I went ahead and took upon myself to do is the binder that was fantastic, that you wake up with post-op. Was like a universal one-size-fits-all. So one-size-fits-all rarely fits all, right? Kind of like with surgery or rehab, it's individualized, it's prescriptive. So after the initial swelling, which I probably had, oh my gosh, at least 6 inches around my waist of swelling, because it fit perfectly with 6-7 inches to spare when I first got it, is now too big. So that's good, right? My binder is too big now. And so I went online, fortunately, was able to find one that shipped. Can't see it very well from here, but it is pretty long, and it has multiple elastic straps that all stay off the incision sites so that you're not getting any hot spots or the compression being unevenly distributed. In other words, sorry, my glasses are crooked, it's hard to see. So wearing that actually diminished more pain. I'm able to do bed transfers, rolling over in bed with a lot less pain. Lying down to sitting up, less pain. Sitting up to standing, I'm not getting as orthostatic. My blood pressure seems to be normalizing now. So if you're feeling that, internal pelvic pain, that feels like pelvic floor tightness or, sharpness, one of the things that, you could try is legs up the wall pose. And I also used the weight right between the legs. You could use a weighted blanket. That could also help. And being a real expert at breathing, that was the biggest thing that took me through the immediate post-op pain, is Ujjayi breathing. I remember waking up in the recovery room and immediately feeling orofacial tightness and shallow breathing. So I started doing the Brahmari or Ujjayi breath, which is kind of a noisy inhale and exhale. Think of it as a deep sleep type breath. I immediately started doing that, and I remember I am so pelvic PT through and through. I couldn't even stop myself. I woke up and I was already actually doing orofacial release. I was doing it like in my sleep practically. Because I woke up to my hand on my SCM and mylohyoid and scalenes, and I was just trying to release this whole left side, because they did a lot of work on both sides, but the left side was completely seized up. So deep breathing, which you can find on my YouTube channel under the Medical Therapeutic Yoga Master Me First list. Go there, and then the orofacial release, part 1. As well as legs up the wall. I have been doing some light lymphatic drainage. So if you need to set up an appointment with your PT or OT who is certified as a lymphedema therapist, that could be fantastic. So I started doing some gentle lymphatic work in the abdominal area, because my body loves to create seromas, and last thing I need after this surgery is an abdominal seroma. Yeah, that's about it. I'm resting more today, less gravity, doing my ankle pumps, preventing blood clots, but more rest today. I've got a huge stack of reading material next to me to help do that, and I'll check back in a day or so.